Welcome again to everybody. And of course, before we begin, as always, we want to take a moment of silence just to honor all of the victims of this COVID-19 here domestically and around the world. So let's take that moment of silence. Thank you. And of course, we also want to honor all the frontline workers in this pandemic, from the health professionals to those who work in the food industry to make us survive this. And as Indigenous people, we always want to honor all of the Indigenous people on whose land we occupy, wherever we are. And then I want to start with just some word of gratitude to the speakers, especially and the organizations that they each represent, whether they formally represent that organization or informally. I know they come with experiences from those organizations, so we want to honor that. I want to thank them. I'll introduce them in a bit, but just want to formally thank them this time. Of course, the sponsors of this virtual village meeting. I know that all the folks who've identified themselves to support this event, we're grateful to that. I also want to shout out to my own university, San Jose State University, for hosting us on this technology, Zoom. And of course, to all of you here on the Zoom call and on Facebook Live, thank you all for joining us. And please stay safe. If I haven't introduced myself, my name is Raatior. I am the program specialist at San Jose State University, particularly at the College of Professional and Global Education. I am doing this as not necessarily part of my work, but it is part of the effort of the university to engage in the community. And as a Micronesian, as a Pacific Islander, personally, I'm involved in that work. So just shout out to folks and everybody. Let's continue. This is a new slide that I added on after I had sent the slide out to my colleagues. But I want to spend this time to just dedicate this event to the late Dr. Joaquin Peter. I think for many of us, his death was a great loss to us who advocate for our COFA people. He was a true inspiration to many of us. All of us are doing this out of the goodness of our own hearts. We're not asking for money, but if you do feel compelled to carry on the legacy of this man who would have been here with us, feel free to visit that website, jojoscholars.org. And if you're compelled to support the next generation of COFA citizens, especially in college, please offer some donations to that. Okay, I was going to try not to get emotional on this, but I think it's important that we dedicate this event to him. All right, so before we begin, I'm sorry, I think I passed. Before we begin, I'm going to take a quick poll. So for those of you on the Zoom call, a new poll is going to show up, a poll will show up, essentially asking this question. What role do you currently have in the COVID community? This is an anonymous poll. We'll just take a few seconds, maybe 20 seconds or so. If you can, go ahead and click it. Click as many of those that pertain to you, just to give us a kind of a good bearing on who's on this call with us, who's in the village, with us to share their experiences. I'll share the result of this poll in about maybe 5 seconds. All right, so we're going to close this poll, and so I'm going to share with you then who's on this call, just so that we all have an idea, right? So for those who may be joining us by telephone, what role or roles do you currently have in the community, in the COFA community? At this point, 43% of the 82 people on the call right now on the Zoom call, 43% are community and organizational leaders, 26% are parents, 21% teachers or professors, 23% are service providers, 14% are students, 25% are researchers, 6% are government officials, and only 5% have no connection to the COFA community. And so thank you for taking that poll. I think it's important just so we have a good bearing of who's at the table and who's sharing thoughts with us to join these panelists. All right. Let me take that out. So before, I wanted to introduce the next speaker in a minute, but I wanted to share this question. This is one of the questions that was actually submitted by one of our own plan members. I had asked her permission to out her because I think this is an important question that I think sets the tone of what it is that we're getting. Of course, this question was posed after we opened registration, after we had done kind of some planning, but I think this question kind of posed. I'm gonna read the question. For Pacific Islanders, honoring special occasions, birthdays, weddings, funerals, etc., is a critical part of community and family support systems. Given this pandemic, it can be difficult to practice social distancing or not showing up because of self-care, knowing that one may be in the most vulnerable population without feeling like relationships will be tarnished, people will be deemed as not caring, offended, etc. Any thoughts on graceful and understanding messaging that we can continue to share to build stronger support for each other across our differences without exposing people's vulnerability? Knowing that health disparities have always existed within our population, can you discuss how the protective measures of this pandemic can help save one's life at this time, even if this is not COVID-19 related, given the challenges one already faces? In doing so, can you share some examples of the trickle-down impact that has on a systemic to an individual level? I personally chose this question because I think this is the challenge that is on the table for us. This conversation really began with the intention of providing some support to our COFA population in the US. Began with conversation with Dr. Will Alick in Hilo and Dr. Shelton Brooklyn in Arkansas. And it moved beyond that to those who have been invited to be on this panel. It was meant to be an opportunity for us to provide awareness, but also maybe share some tips to our community. But I think this question that Bini had put there, I think encapsulated, I think what originally started for, which has now led us to this moment. So let's go ahead and begin. I'm going to introduce our first speaker, Dr. Shelton Brooklyn Md is the Associate Professor at the University of Arkansas Medical Sciences. He's a Marshallese family medicine physician, and the Peter O. Kohler MD, Endowed Distinguished Professor in Health Disparities, and an Associate Professor in the Department of Family and Preventative Medicine at University of Arkansas Medical Sciences. He received his medical training at the John A. Burns School of Medicine at Mano. What we thought that Dr. Shelton can speak about is just to set the tone and the context of this discussion. I think we're going to be talking about data. We're going to be talking about stories of our people in the news. We're going to be talking about how government supports or lack of support for our folks, and talk about some maybe culturally appropriate, culturally sensitive tips for us. But what is that conversation? How do we understand the stories and the context of the COFA community within the larger context of the Pacific Islander community, and maybe the disproportionate number of people of color that are affected by this pandemic? So Dr. Shelton will maybe speak a little bit to that just to set the tone for us. So Shelton?
Yeah, well, everybody. It's afternoon in Arkansas. It's a good afternoon from Arkansas. Very happy to be here today. And first of all, I want to give thanks to our Heavenly Father for life and health for all of us today, including our family members and everyone else. I want to thank Dr. Raatior for the opportunity for planning this and having this discussion. This village virtual meeting, I think, is quite important for us to kind of share our thoughts and share our resources and share what we know and our challenges as well. Also want to recognize our panel members on the call this afternoon here in Arkansas. And, Dr. Vid, asked me to talk a little bit about, setting the context of our discussion today. Community health disparities for Pacific Islanders, how should we think about these short and long-term goals? I think for us to start thinking about this, we need to define certain things within that context. What community are we talking about, and what are these health disparities that we're talking about, and what Pacific Islanders, we're talking about as well. We all come from different avenues and definitions, and we're all situated in different parts of the world in the US. Is the community that we're talking about, is it the minority community in general? Are we talking about the colored community, including the Blacks and the Hispanics? Are we talking about the Native Hawaiians in the Pacific Islander community? Because that's one of the definitions that we come across all the time. Are we talking about the Asian Pacific Islander community, or just the Pacific Islander community by itself? And then within that Pacific Islander community, there's the Micronesian community. And within the Micronesian community, there's the COFA community, which is a new vocabulary that has come out in the last few years, Compact of Free Association community. And for myself and many of the members here in Arkansas, we're very familiar with the Marshallese community within Northwest Arkansas, because in Northwest Arkansas, the large Pacific Islander community is the Marshallese. So, it's always, you have to define what community we're talking about. And, I know that we're talking about COFA, we're talking about Pacific Islander communities, but depending on where you are, it depends on who you're approaching in terms of what definition you're using. For us, and for me, coming from Hawaii to Arkansas, how I define myself or how I approach and others here, how do we approach the politicians or the leaders in the communities varied. And I came to learn that real quickly after I moved here from Hawaii, because, I needed to focus on the Marshallese, because I would say 90 to 95% of the Pacific Islanders here in Northwest Arkansas are Marshallese. So when we speak with the government leaders and we speak with the CEO of the hospitals, or we speak with Department of Health and Human Services, we talk about the Marshallese, but we don't forget about the COFA community as a whole. So for us to make any kind of headway, we have to speak about the Marshallese. So when they speak about us, even during the governor's press conferences, even during the news outlets, that talk about the Marshallese in Northwest Arkansas, because that's who they relate to. But as we're trying to make changes, as we're trying to advocate for our Marshallese community, we include everybody else along the way as well. So even when we're going to the legislatures, that's what we do. So I don't have to break down all those different definitions of communities, but I thought that I'd bring that up. Because as we're working, especially during this pandemic, and I know that our Consul General is here with us today on the call, but we do have a Marshallese COVID-19 task force. And we formed that knowing that for us to make changes, for us to reach across from our community to the politicians or to the leaders or to those who are in the health field, we need to speak about our needs. But at the same time, we know that our needs would help others in the COFA community. So who are the community that we're talking about? And most of the communities that I just mentioned earlier is basically are those communities that are the marginalized ones. Those are the ones that are confined to the edges of society and brings forth all these challenges that basically this pandemic has brought to light and actually has exacerbated many of the challenges. So we are the same, but we're also different. We are the same because of our cultures, with our beliefs as Pacific Islanders, as Pacificans, but we're also different as Marshallese or Micronesians, or even COFA citizens living in Northwest Arkansas versus those in Hawaii and Oregon and Washington State. So we have to understand that part. We know that we're the same, but we're different because then we have different ways of trying to reach those that are in need. So, it's always been uncomfortable for me as I am doing all these things here in Northwest Arkansas, along with my fellow advocates here in just talking about the Marshallese and Marshallese and Marshallese. But at the same time, it feels good to make headway, but I have that uneasy feeling of thinking that I'm leaving out others, but at the same time, we bring them in whenever there's any kind of advancements and such. So that's the first one I wanted to at least define for us today. The second one is health disparity. Exactly what is health disparity? How do you think about what is health for us, Marshallese, COFA citizens, Pacificans, or anybody in general? And many of us have always, approached health in different contexts. And for me and many others, we see health as a state of complete physical, mental, social, and personally spiritual and cultural well-being, and not just the absence of disease. And many things affect our health. And it has to do with the physical health, mental health, and then spiritual and cultural health. But health for many of us, especially for Micronesians, especially for Marshallese and COFA citizens, it has to do with the social determinants of health. You have to address those for you to be physically healthy. You need to address the education piece. You need to address the food security piece. You need to address the housing piece, the employment or the loss of it. You need to address the social structure. How do you connect the resources? You need to address the language and literacy as well. Because it's one thing for us to reach out to the community, but it's got to be in language for us to fully understand it. We all understand that given our different genders, given our different age groups breakdown, we all see this differently. And living in a place that is not where we're from also gives us its challenges. So we need to address all those, including our culture. And it's good to kind of see Benny's, first question there to kind of set the stage, because we do need to use our culture. It does present its challenges, but at the same time, I think it's also one of the key points that we're able to address these things. Our challenges of being a collectivist culture, our challenges of being a communal culture in such a time of a pandemic, but at the same time, this is what we need to use to address these things. Our culture is based on the family. Our culture is based on the community. So who else better to address family and community challenges than us? Because that's how we grew up with. As Pacific Islanders, we hear and read about the reports of being disproportionately affected by this pandemic, and not just in Arkansas, but in different states, in Hawaii, in Oregon, in Washington, and California, Utah, and other places as well. And I know that one of our panelists will go into more detail about that later, so I'm not going to touch upon that. But the bottom line, when it comes with the numbers with Pacific Islanders, we definitely do need that disaggregated data. That's so we can better analyze the situation, exactly what is the situation that affects us, and then we can respond appropriately based on that. And Vid asked me to, address some of these short and long-term goals, based on this. And that's quite difficult to answer, at least for me. I think, it's all mixed up at this point. Our short-term goals 20 years ago have become our long-term goals. For us COFA citizens, we're still trying to right that wrong that occurred back in 1996. That restoration of the Medicaid for our families. It may not apply to many of us who are currently working or we are job security, but it's now affecting more and more of our family members out in the different communities who have lost their jobs and have lost their insurance, and they need to apply for Medicaid. So it affected them more in terms of their families' healthcare access. So for me, as I'm looking at it, short-term goal-wise, it all depends on what community you're coming from. All depends on what organization that you're also representing within each state. But it is incumbent upon us community members and advocates to fight for and advocate for our families to have to have access to healthcare in whatever region or whatever community you're representing. And I know that it's different in Oregon, it's different in Washington, it's different in Hawaii, it's different in Arkansas and other places. But this is the time that we really need to make sure that our family members, our communities are connected to that healthcare access. And we fight in our different ways. Long-term goal definitely is that restoration of that federal Medicaid, or covering our FAS Allies Act or the COFA Act. And we still continue, and many of our advocates, many of our organizations, including MUBI and COFA Clan and COFA CAN and others, we are still advocating for this, to have that strong bipartisan support in both houses. And we're thankful for those who've been sponsoring this, putting that forward. But we also need to address these immediate needs of our family members. That food insecurity, they need the food so they're healthy, so they can go and get a job. Their job losses, their housing challenges, having 8, 10 more households in a house that may have a person with COVID-19 or somebody who's a contact of somebody. It's challenging, but there are ways that I'm hoping that at least the discussion today will address some of those things. But we've heard this phrase many times before, but we do need the whole village for us to address these. Long-term goals, I still see that as being visible, contributing members of our society. I think as people see us and they understand who we are and our values and our culture in their societies, as members of those societies that are contributing positively, that's going to go a long way. So I think we need to stay involved. We need to be visible in a positive light with our local city, state organizations. You know, I've given many talks before in the past, and a friend of mine is always coming with me to these talks. And every time I would talk, I would say, you know, us Micronesians were passive aggressive, but he kept correcting me. No, you guys are passive, which, you know, is true. You know, we are passive, but, you know, I don't think this is the time for us to be passive. We definitely need to be strong advocates. We need to be visible. We need to come out of our comfort zones so we can address these long-term goals. We need to connect our oceans. You know, I think our different lakes or different lagoons are separated from each other. But if this is the time that we as COFA communities, as advocacy groups in different states and larger organizations, we need to connect. We need to connect so we can bring that bigger ocean of Pacificans together so we can address many of these things. And we need to stay connected. We need that resiliency. And we know I've given talks in the past about resiliency among our Pacific Islanders. We know our history. You know, we have a history of colonialism. We've had our population decimated by the introduction of new people, new diseases, and ways of life. But today we're still strong, we're coming back. And we need to learn from our past so we can deal with the present so we have a better future. So we need to use our cultures, learn from our ancestors. Our cultures are unique and we need to keep them alive because, you know, I think our cultures is what's going to bring us out of this. We need to remain a strong, resilient, humble, family-founded people. And traditionally, we all know this. You know, we've been traditionally navigators. And this is a different ocean, different landscape, different space. But based on our cultures, you know, we need to be traditional navigators and we can navigate through these rough waters as we go. So those are some of my comments. I will stop this because I know there's others on the panel, but I will be more than happy to answer questions later on. Thank you.
Thank you very much, Dr. Shelton. You know, we can't clap because everybody's muted, but a shout out clap to you. This was a very important, I think, the setting of the context is a very important, I think, component of our conversation here because we could get bogged down in the COFA and in our own world, but I think it's important for all of us to keep in context the larger picture and how we fit into that and how we lead and maybe challenge those. So moving from Shelton, from kind of setting the context, I want to introduce Anita, who is a journalist. Just a shout out to Anita because I think she and others in the Civil Beat have done a good job in shedding light on you know, on the successes as well as the challenges of our Kovat community, particularly in this great state of Hawaii. Anita Hufschneider is a journalist at Honolulu Civil Beat, where she writes about social issues. Her work has also appeared in The Guardian, The Wall Street Journal, the Associated Press. She's a Chamorro from Saipan and graduated from Harvard in 2012. And we thought that what Anita could speak to, she wrote at least, I became aware of this disparity of Pacific Islanders with COVID-19 from her writing. You know, I think before that, you know, watching the news, you hear about the disparity of the African-American communities, at least here in the continent. But it was a really great surprise. It was, you know, actually very alarming for me to read Anita's pieces and articles in the Civil Beat. So I want to recognize her and ask her to speak to that and what has come up in the news. What has she learned from that with regards to the disparities, and just share some light for us. Anita, if you would unmute yourself and go for it.
Thank you so much for that introduction, that kind introduction, and thank you for having me here today. It's such an honor to be invited to be one of the speakers here. So yes, my role today is to talk about what some of the data is saying about Native Hawaiians and other Pacific Islanders. And so I'm actually working on the story this week. It was supposed to be published today, but it'll be published tomorrow, about what the disparities look like nationwide. And so I went through different state level data, and the way that the data is categorized for people who aren't super familiar with this is that the broad category is Native Hawaiians and other Pacific Islanders, or Native Hawaiians / Pacific Islanders. And so unfortunately, I didn't see any states that were keeping data in a way that the COFA community could be sure was referring to them. For example, I didn't see a state that broke down Marshallese or Palauans, for example, and I didn't see anyone who was breaking down data based on citizenship. However, it is a very evolving situation, and I know that locally, the Native Hawaiian community is really pushing our State Department of Health to disaggregate the data because they want to know what the data is specifically for Native Hawaiians. And so I can, I think that is something that can change. But for now, what I found just looking at different state level department data was that there are disproportionate rates of COVID-19 for Native Hawaiians or other Pacific Islanders in California, Alaska, Colorado, Oregon, Hawaii, Utah, Arkansas, and Washington. So in Oregon, I think it's been previously reported, I know I did something and others have written about it as well, that Pacific Islanders there have the highest rate of COVID-19 compared with their population, 16 per 100,000. That's more than 3 times the rate for white Oregonians. And so when I talk about disproportionate, or when I read about this data, what I'm understanding is they're looking at the rates of coronavirus infections compared to the size of the population. So in a lot of places, the population is relatively small. And so it's not necessarily that there are hundreds or thousands of cases involving Pacific Islanders, but that compared to the size of the population in that place, they're experiencing a higher percentage of their population getting sick than other communities. And also I would say that just saying this data, I'm not the person to speak to about why that is the case. I think others on this panel will be better fit to speak to that. But this is just sort of what the state departments, various states have been, their health departments have been reporting thus far. So in Washington, for example, Native Hawaiians and other Pacific Islanders comprise 1% of the population, but 2% of cases. In Arkansas, Pacific Islanders make up only about 0.3% of Arkansas's entire state population, but so far they're making up 1.2% of coronavirus cases in the state and 1.4% of deaths. In Alaska, Native Hawaiians and other Pacific Islanders only make up 1.1% of the population, but they comprise 3.4% of coronavirus cases. So that's more than 3 times their population. And in Colorado, the community makes up 0.12% of the population, but a report I saw from mid-April said that they comprise 1.61% of COVID-19 deaths. And in Hawaii, they comprise 10% of the population. This is for people who identify as Native Hawaiian or other Pacific Islander alone, and so not people who are identified as mixed race. 10% of the population, but they make up 13% of the cases. And in Utah, they comprise 1.6% of the population, but make up 2.9% of cases. And we also saw similar disparities in California. I saw a couple of papers reporting that the death rate for Pacific Islanders in Los Angeles County is 12 times higher than it is for whites, for example. So I know I just threw out a lot of numbers out there, and but I think that the main, and one thing to keep in mind is that these are really evolving. So every week, state health departments are releasing new data, and so for example, in Hawaii, the numbers have changed, over time. You're seeing more of a disparity now. And so I would definitely take them with the idea that they're sort of a snapshot of what's happening right now. Another point is that a lot of states aren't reporting any data on Pacific Islanders, or they aren't disaggregating it. So I found several states where Pacific Islanders were lumped in with Asians or with Native Americans. And, from people I interviewed, it seems like there's a lot of reasons for that, depending on the community size in that area, or as well as, what sort of data collection is happening at the county level. For example, I couldn't find data from the state of Nevada, but I did find data from Clark County in Nevada showing a disparity. And so I think that this data can be really useful, and it's good that at least a few states are starting to report it. But there's also, a lot of limitations. So I just wanted to share some of these findings. And like I said, I'm working on a story about that right now. And so I will be, hopefully that'll be publishing on Civil Beat tomorrow. And I interviewed several people actually who participated in this panel. So you might see more, more context included there. But I guess, one of the takeaways is that you are seeing these disparities emerging even with the limited data that we have. And another thing I would just mention is that I'm sure others will talk about this more. There's definitely a lot happening in various states to address what's going on, and many people here are participating with that directly. For example, in Arkansas, I spoke with Melissa Leland, who is talking about the work that she's doing to try to help people not only who are affected health-wise, but also are trying to find housing or rent help. And in Hawaii, we have Josie Howard with We Are Oceania, who has been working round the clock to help people apply for unemployment here, where we're seeing record unemployment numbers. And so there are other challenges that the COFA community in particular is facing. You all know this. I'm kind of saying what you already know, but it's not just the health data that's the challenge, it's also the significant economic challenges. And one other story I worked on recently that's specific to people who are COFA migrants was looking at unemployment application challenges here. So in Hawaii, the unemployment has really skyrocketed, and a lot of people had a difficult time getting into the mainframe in order to into the system to apply, because it's an online only system for the most part, unless you could get through by phone, which was very challenging. And so what the state did was they set up a web form in order for people to be able to apply more easily. And it was a great idea. But what they did was they left out the I-94 option. And so if you wanted to sign up and you said you were not a US citizen, the only option was an alien registration number for a while, for several weeks. And so they ended up fixing that after we drew attention to it, and so that was helpful. But the way that the sort of the workaround that they had was that you could put in your I-94 number, but not the entire thing, because it's only like part of the I-94 number. So these are some of the challenges that I think that I'm observing COFA migrants having, in Hawaii, and I've also heard of it happening elsewhere. And so, I'm hopeful that I'll be able to continue writing about these issues, and that the work that I do will sort of help shed light on these disparities. But yeah, I didn't want to take up too much time because there are so many people here who and have a lot to contribute. So if anyone has any questions, I'll be here throughout it. So happy to talk about the data later on if people want to talk about it more.
Great. Thank you so much, Anita. Appreciate that. Again, I think we're moving from the larger context to, sort of honing in on this. And so the next speaker on our panel is Virginia. I'm going to introduce her in a minute here. So Virginia Lucas is a Palauan, it's first thing, researcher, educator, equity advocate for Pacific Islander culture and history with special focus on Micronesia. She is the program specialist senior for the Pacific Islander community with Multnomah County's health department in Oregon. And what we've asked her to talk about is to begin to maybe break open, sort of make sense of this data. Anita obviously threw out lots of the data that she's come across in her reporting. But what does that mean in terms of how is the data, how do we understand the data within the context of a specific community, and in this context in Oregon? What are they doing there, and how are they doing successfully, and what are maybe some of the challenges that they're facing? And hopefully we can learn from that context to other areas of the US where we have our citizens residing. So Virginia, thank you so much. Unmute and please go ahead.
Thank you, Dr. Vid, Gubral Masulang, Ali, and hello everyone. Thank you all for being here, and I'm so honored to be a part of today's panel discussion, and I'm so grateful for all the people who have helped to take the initiative and the courage to make this event happen. Thank you so much. So as Dr. Vid has said, for the purposes of our discussion today, I was asked to make sense, to really try to help make sense of the data that's been collected in Oregon. And I thank Anita so much for sharing some of those numbers. But before I really dive into those numbers, I would really like to start with highlighting the following. First, I really want to talk about the methods that we go about collecting, analyzing, and sharing COVID-19 data. Really, any data in general is very important. Second, we need to know where our data is coming from. And then after that, I will talk a little bit about the Multnomah County Regional COVID-19 data dashboard that has been launched. And towards the end, I will talk about how our Oregon Pacific Islander leaders and members are reacting to COVID-19. So here we go. So Multnomah County has launched a regional COVID-19 data dashboard that shares some of the counties in Oregon, including Multnomah County, Clackamas County, Washington County, and Yamhill County. So I just want to make clear it does not contain data from any other counties in Oregon. And I also want to share that Oregon Health Authority has their own data dashboard as well. Now, how we collect, analyze, and share COVID-19 data, I just want to say, we have to go back and think that the numbers are great, they're a start, but what's really important for us to get at is our lived experience and our stories that explain, some of this. I saw in the chat box, that Dr. Eileen Duldula, who's on the call right now, she went ahead and put some information such as, reminding us that we are grossly undercounted, that there's a reason why states don't share the collected immigration statuses. I know one reason is we don't want that information to be weaponized against our immigrant population. And also I saw that Sarah had shared that she's afraid that, widely distributing some of this data is going to further stigmatize our community. And yes, it can definitely, and that's why we have to make sure that along with the data, along with the numbers, comes the stories to have an explanation upon it. So I just wanted to mention that. I saw that in the chat box before I go on. And so I just want to really clarify that anytime we are doing data collection, analysis, and sharing, it should always be centered and led by the communities that are actually being researched upon, and that they should play the leading role in order to ensure there is autonomy and advocacy that is being led by the people who it is affecting. And we need to honor them and their culturally based story throughout their perspective from start to finish. They should not be an afterthought. It shouldn't be data is collected, researched, and then just dumped on the community. We should be vigilantly part of the process from start to finish. The way that we collect data and analyze it and share it, we know that that leads to defining and controlling knowledge. And that knowledge is used to understand the strength and disparities in our various communities. It helps to make decisions about allocating resources, funding, as well as informing programs and policies. And we really need to prioritize sharing data that our community can easily access, that they can understand it, and that they can share it. I was part of a team there was a specific team that put together our regional dashboard, and then a sub-team was put together that I was on with Dr. Duldula and all sorts of other amazing researchers, and community leaders to ensure that our BIPOC community, our Black, Indigenous, people of color, to really ensure that it was useful for our communities, and not just for the researchers and not just for the policymakers. We want to make sure that our community leaders, our community members, also have access to it and can understand it. So the regional dashboard made some edits to make sure that it is a little more accessible to our BIPOC folks. I also want to share that anyone collecting any kind of demographic data should be disaggregating their data. For example, they should not have just a broad API category. Those two categories should be separated, and then there should be several ethnic categories under those to choose from in order to fully, authentically self-identify. And this helps us to really have a more nuanced understanding of people's lives. Now, in the Pacific Islander community, there is little access to disaggregated data in general. And if we don't have access to quality, dependable, reliable, disaggregated data, we are undercounted, which also means we're underserved. And it also means that potentially that our Pacific Islander families, our collective families, it can lead to more deaths, longer recovery periods, and a lack of access to resources that we fully deserve to have. And on that note, please fill out your census if you haven't. Please make sure that you have the opportunity to write in your ethnicity. So for example, I cannot pick Palauan. I have to go other and then Palauan. Part of my job, I get asked all the time, how many Palauans do we have here? Or how many Chukis, Marshallese, Yapis, Pohnpeian, Chamorro folks, right? And I say, well, until we have better ways to collect data and better ways of reporting and self-reporting in a very authentic way for our communities, we can only guess. We know as a community that there's way more than what's actually reported. And so please, 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 I encourage you to please make sure that you do your census. Thank you so much. I also want to let you know that in Oregon, a Real D law was passed, and Real D stands for Race, Ethnicity, Language, and Disability. And it was created to provide a consistent method to gather information across the state data systems and to help us notice and address health disparities. But the reality is not every health system is using Real D. But I do want to say that Multnomah County is using Real D collection methods for the COVID-19 cases that we have. And if you are interested, there is an online toolkit that you can access for more Real D information. So I'm going to move along to, let's see, where do we get our COVID-19 data from? So some caveats that I'll go through first. So one, these numbers that are being published, these are only numbers based on who has tested positive. So people have gotten sick, they've gotten care, they were tested, and those are the numbers that are counted. And so we have to really think about, well, what about the other folks who haven't been tested who may be sick too, right? There are other reasons as to why maybe someone who was sick has not accessed testing. And as we know, there are folks who have been asymptomatic, didn't even know that they were sick, until they get tested positive, right? So, or maybe they have a mild case and maybe they try to contact their doctor and their doctor for whatever reason said, go ahead and just stay home for now. We also know that there is a severe lack of access to testing. I've heard of many Pacific Islanders who said, I had so many symptoms, I called my doctor's office and they said just to stay home. So we know that there is a disparity. There is people who could potentially be sick, who didn't even have access to the testing to begin with. And so we really need to remember that that number is only based on the ones that we have found out about. I also want to share that the numbers that are on the regional dashboard, they come from 3 different sources. So first, it can come from the doctor's medical chart, it can come from a lab that processed the test, or it can actually come from the patient itself. So for example, if I got sick, I go to the doctor takes note of my medical history and my symptoms and decides to order a COVID-19 test for me. I do the test, it gets sent to the lab to process. The lab finds that I'm positive for COVID-19 and my doctor and I both get the results. Now the positive test results is sent straight to the health department, and someone from the health department will probably go look at my chart and find my information in order to do a follow-up, the contact tracing part of it. Or a doctor might actually just choose to call the health department and let them know about my case so that the health department can follow up. Or maybe myself, as soon as I get my positive test, maybe I'm thinking, what do I need to do? So maybe I call the public health department to understand my diagnosis and to look for resources to help take care of myself and my family. Just personally speaking, I live at home with 6 people in my house, including my 80-year-old mother. So I have to be very vigilant about making contact, staying at home, making sure we're doing all the things that we need to do, because it's really my mother that I'm protecting. My Palauan mother, who was 80 years old, I really fear for her. And that's, why we do this work, right? We're protecting all of ourselves and our loved ones. So going back to the dashboard, our regional group has focused on improving data analysis and critical real-time data sharing. And that dashboard, it shows COVID-19 cases, hospitalizations, and deaths broken down by age, gender, race, and ethnicity. It also provides details on testing, housing status, and underlying health conditions and symptoms. Now, again, I want to state that OHA also has their own data dashboard, and some of the numbers might be different. So at this time, OHA, the Oregon Health Authority, they have reported that 2,742 people have been tested positive with COVID-19 in Oregon. And out of those people, 27 of them have identified as Native Hawaiian and Pacific Islander. On the Multnomah County regional dashboard, we have a total of 22 Native Hawaiian Pacific Islander cases, and 18 of them coming from Multnomah County itself. I also want to mention that in Oregon, we have 287 people who have tested positive that we do not have their ethnicity. And so theoretically speaking, these could be BIPOC community, it could be Pacific Islander folks, that could be part of those numbers. After OHA published their race and ethnicity data starting on April 22nd, and thanks to the article that was written by Anita Hushnider, who just went before me, we in Oregon, we realized our Pacific Islander leaders, members, Dr. Duldulau, who is a community epidemiology, who's on this call right now. She's an epidemiologist for Multnomah County Public Health. We realized that there is a high case percentage of Pacific Islanders with COVID-19 in Oregon, and that we needed to be listed as a high-risk population in order to get more services provided to help our Pacific Islander community. And so since then, in the past 2 or 3 weeks, our Pacific Islander community leaders and members throughout Oregon have come together to create an emergency response team and also to coordinate with the National Pacific Islander COVID-19 response. And I really want to send out a special shout out to one of my best friends, Mano Ala'i Lima. Marlowe sent me the very first email that said, "Hey sis, have you seen these numbers? Have you seen this article?" And that really just pushed up to contacting Dr. Duldulau, who then contacted all the people that we needed on Multnomah County leadership to be on our side, to hear what we're going through, and to really spark this movement. So I want to say thank you so much to all the people who listened and got more action going. Our response team meets every Friday from 6 to 7 to provide updates, share resources, and find ways for us to advocate for our needs. And while the work started in Multnomah County through the efforts of Pacific Islander Coalition folks, we are an Oregon-wide effort, and we want to make sure that our collective Pacific Islander families in Oregon get what they need, not only to survive this pandemic, but also to to thrive for post-recovery. And so, yeah, those are my latest and greatest that I wanted to share with you. So thank you again for listening. Thank you again for having me here.
Mahal Masulang, Virginia.
Thank you so
much. Okay, so we're going to move on to our next speaker. So again, for those who maybe just join us, we will open up for Q&A at the end of the panel presentations. Feel free to post your questions in the chat room. You can access it below. But also thanks to those who've submitted questions on the registration process. We're going to go ahead and move to our next panelist. So not one of the things that's coming up a lot, even before this panel, is in terms of resources. And there are obviously leaders in our communities who are collaborating with the government officials, particularly in Oregon. I want to give a shout out to CAN, Washington, CAN, which I think Joe will speak a little bit about, but in terms of what they've been doing in the government. So Honorable Joe Enlet is the Consul General for the Federated States of Micronesia, Consulate General in Portland, Oregon. He's a fellow Chuukese with me, and also one of the founding members and president of the Compact of Free Association Alliance National Network, otherwise known as CAN, in Oregon, which has done a lot of advocacy work and has really successfully, I think, implemented what the rest of us around the United States want to do in terms of how we work with the government to provide some of those resources. So Joe will speak on that topic of advocacy in the government, seeking support for our community and where the services are. So Joe, if you would unmute and go ahead.
Thank you very much, Vid. I want to recognize you, Dr. Vid, for your efforts in putting this together. I think this will serve as a catalyst for really organizing COFA as a community and as a group that wants to take care of our community. So thank you very much for doing that. Raranim and Kiriso Jabur Ngariya Verisin. Thank you all for being here on this this virtual call. I also want to be thankful for this opportunity to speak to you all. Thanks to Vid for inviting me as well. I thank God for the life and strength that he continues to give us to be able to be here and just to have another day added to our lives. So for that, really grateful. I do really want to recognize the people who've gone, who've presented and will be presenting. I feel very fortunate to be with everybody here who have so much knowledge and expertise in talking about COVID-19 and our community. So it makes my job easier because then I don't have to say too many things. A lot of what I was circling in my mind has already been spoken and elaborated far better than I could have said it. So my words won't be too long. First of all, before I go any further, I think it's important to recognize what has been noticed in the international community. And that is the reality that many of our Pacific Island countries, including the COFA countries, Palau, the FSM, the Marshall Islands, or what we're calling now COFA, remain COVID-19 free to this day. This is pretty remarkable. It's remarkable on so many levels, but it's even more remarkable because of the fact that our countries, recognizing the risks of the pandemic early on, were some of the first countries in the world to take swift and aggressive steps to combat the disease. These were not only in the form of strict, travel restrictions, but also establishing national and state COVID-19 task forces, early consultations with partners such as World Health Organization, or beefing up our health and emergency trainings, and aggressive pursuit of resources from world allies, including the United States. So our government itself, or our governments within within Micronesia also kind of started the cue on being prepared, and also showing the importance of advocating and speaking up about our needs. This is indeed something that we can all be grateful for and to be proud of as Micronesians. Though, you know, no country will be perfect, but we can recognize those victories. And we do care about that because a lot of us Micronesians, our communities, our families are still back home. Many of our brothers, siblings, and cousins, and aunties and uncles are in our homes. And we, even though we're here, we still care about them. And so it's really important to recognize that those efforts from the islands that we come from have been pretty successful to this point, but we can't let our guard down. What may not be as apparent though, and this is how I'm going to segue into the idea of advocacy, is the amount of advocacy and the outcry that we witnessed in our home islands as well. Many of our citizens inside and outside of the islands engaged in advocating and speaking to our political leaders and, you know, asking them to maintain travel restrictions and to think about our people first and foremost. For instance, in Chuk State, if you are on social media, on Facebook, you'll see that there were multiple live videos of certain, you know, of citizens, both young and old. We had students from the schools, healthcare workers, mothers who took a stand for the lives of our people. And that's something that we don't often see in our communities back home. But when this pandemic began and the world was recognizing the impact that it was having or could potentially have on our lives, a lot of our people did stand up. And there were marches at the Chuk State Legislature, people carrying signs. I've not seen that much in my lifetime, but it was really interesting to see that. And that shows that as Micronesians, as people who come from that part of the world, there is that sense of wanting to take care of the larger community. And I think Dr. Sheldon really masterfully talked about that, that advocacy is not something that kind of, you know, is alien to us, that we don't do. It is something that is born out of our cultures and something that we can continue to practice. This speaks to the resilience and resourcefulness of our people. It is also good to note that social media has been kind of a platform. Scores of online social groups are gathering for Facebook live sessions. And the things that we're doing here have many ways that it can be impacting our larger, broader society or even our smaller communities. And though, you know, we recognize how useful they are, information is readily available. A lot of people are needing to be socially connected, especially, you know, those who are feeling that they're alone, people who just may not even understand what's going on, but need to be connected that way. But at the same time, it's important to recognize that those platforms can also be used to negatively impact our communities. And here's one way that I wanted to talk about, because it's kind of the antithesis of advocacy, is misinformation. And now in our day, anybody can access any information, anybody can produce information, and it's really hard to kind of regulate what information is going out. And also I feel the burden of community members who themselves are not always able to see the difference between what's fact and what's not fact. And when misinformation is being perpetuated amongst our community members, that can have harmful effects, not just on our knowledge or belief systems, but it also affects our behaviors. If we are told that social distancing is not effective, or that the disease is not real, and that information can really affect the way that people behave during this time, which puts lives at risk. So the first part of advocacy, as a person who's been involved in advocacy, is always looking to get the facts straight, really putting a lot of effort into getting the good data, as Virginia spoke about, and Anita and others, that it's really important to understand and make sure that we're getting the facts straight. That goes a long way to help inform our people on how to deal with COVID-19, or something as unknown as COVID-19. So that's kind of how I approach advocacy, is really make sure that we get all the right information. And as a consulate office, we try to communicate with our communities, and that's our role too, is to make sure that our people are equipped with the right information, that we do our due diligence to deliver messages that are not only factual, but also appropriate, language specific, culturally relevant to our communities. Because I can assure you that our Micronesian communities don't really need these long essay papers on the science behind the COVID-19, though that's important as well. But in the moment, what is most critical is that people understand that COVID-19 may affect you this way by being exposed to somebody who has it. It's important to wash your hands, or some of the basic information, and to make that clear and available and in language. And so an informed population is a resilient population, and that's how we need to kind of frame advocacy, is making sure that our communities are well informed. And this takes a lot of us. Like we've talked about how we need to work together on this front in terms of information. It's important that those people who are looked to as leaders in our respective communities, whether in the Marshallese or the Pohnpeian or Kushayan, church leaders who carry an amount of respect and are esteemed by the communities, we need to work together to be able to make sure that our communities are well informed with the correct and useful information. And I think that's where many of us can play a role in talking with each other and connecting. And I think that's what's really amazing and fantastic about this forum that Dr. Villamaino has started for us. This could be a way that we can share information and be informed. And then beyond that is also the need to really inform others and society. And so it's kind of two-way. It's not just a burden on our communities to stay informed and to be well equipped with the information, but it's also important for us to inform the broader societies, those who impact our lives on a daily basis, whether it be the government or you know, in our local areas, or whether it be local public health authorities, that our communities can also have avenues to tell them that, yes, we come from, say, the Federated States of Micronesia, and that if you're going to do language specific work, that there's not just one FSM language, but that there are several, and not even just one in one state, that each state could have several, you know, language dialects. And so those are some of the things that, you know, people who provide services and the resources that, you know, you should be able to get, they don't often know. And so our people could miss out on these resources too. A great example was also brought up by Anita about unemployment applications. This has been a recurring theme in many of our different states. Now, I want to mention that we need to be also thankful that our people do, in many ways, qualify for the resources that have been coming out in the CARES Act, and also, you know, things like the unemployment benefits. However, it is important to recognize that there are some systemic barriers, such as not having the right category on these application portals to be able to fill in the proper immigration form. That then becomes a huge barrier, and it can be life-threatening. You know, it's a barrier between this person being able to pay their rent and or pay for food, and they can't get it because one field in one system cannot take their information. So there is definitely need for us to reach out to these authorities, and some examples of that have been happening. There are efforts from our office, and I know that other community organizations have reached out. I know that I believe Miss Dina Sheck is here. They have done a great work in trying to look at the policies and advocating as well for Micronesians in Hawaii. And then other groups who are also speaking up about this. Fortunately, we were able to get an answer from some of the state leaders about how to change that or how to do a workaround on those systems. But unfortunately, not all of the states have been able to correct that just yet. So there's still definitely a lot of work to do. But learning from the advocacy efforts that we've been able to do in the past up until now, it takes all of us in the village. Again, I can't state or overstate this. We all have to play our role. Even if I'm not playing a particular role in terms of the health and medical field, we can do our role in talking to others and making others aware of what's going on. If you're a parent, talking to the teachers, finding principals who would be able to speak up to the state governments or county governments about what specific challenges you're facing. And a shout out to all of the COFA or Micronesian advocacy groups that are sprinkled throughout the United States. Some I don't even know, like I'm surprised to find out from like Washington State contacting our office and saying, hey, we just spoke to a group of women who are advocates, and they're bringing up this issue. And I just kind of, did the Micronesian thing and kind of just, oh yeah, but I didn't know that this is the first time I heard about them. But I'm kind of overjoyed to learn that people are rising up and organizing on their own. And there are many different organizations that are doing this in their small ways. And I have to say, if just speaking up, just doing a live video and talking about that experience, those are the components of the larger advocacy framework that all of us can be a part of. So even if you post something on Facebook, know that some people will be reading that. And so it kind of goes both ways, though. If we're portraying kind of an attitude of like, oh, you know, we don't care and things like that, then that can also have an impact. But if we're posting stories and making others aware of what specific issues we're going through, people can pick up on those, and that has been effective. And I can't go into more details and examples of that, but just know that we're really thankful and grateful for all the efforts that you're doing in Arizona, Texas, you know, all the different places around. So thank you.
Thank you very much. Council General. Okay, so we've moved from the government sort of advocacy efforts. Now we're going to move to a speaker in the medical fields. I know it's important to, you know, sort of at least discuss some of these advocacy efforts, some of the data disaggregation, some of the works that other people are doing. But what are some of the medical advices that we might be needing at this point? So I'm going to recognize Dr. Will Alik, MD from Hilo. Dr. Alik practices family medicine and serves as the director of the Kaiser Permanente Clinic in Hilo, Hawaii. Originally from the Marshall Islands, but we claim him as Chukis because he went to Xavier. Dr. Alik is a graduate of Xavier High School and received his medical training at the University of Hawaii, John A. Burns Medical School, where, incidentally, where Dr. Shelton also went. He has been practicing for over 20 years. And so we thought that Dr. Alik would do is to talk about some of the preventative healthcare that I think are important in terms of, again, immediate and long-term action items that we might need to be doing, whether we're leaders in the community or ourselves as citizens taking care of our families. Dr. Alik, Will, if you would unmute yourself.
Ryan and Vid, Yokwe. It's about 10 o'clock here in Big Island. It's a nice day today. So first of all, I give a shout out to all the panelists. I am really glad to be a part of this. It's an honor and pleasure to be to take part in this very important forum. So I remember like in Vid reached out to me I think about a month ago. The plan was to kind of do some kind of messaging on the Facebook for the MU, Micronesian United. Kind of like morph into like, maybe let's do a video, okay, video kind of thing, you know, and then that morph into this. And this I think is a better forum, which everybody can take, you know, take part in this. So to me, thank you, Vid. You're the man. I think to understand this COVID-19, it's important to have some, you know, some nomenclature kind of like that down. Yeah. So, you know, what this COVID thing is all about, some basic information. And as the Council General from Inlet said, information is the key. And that's really the key. Without the information, like, you know, we're not going to move forward. Okay. So we need to know the basics. Okay. Understand this disease. And it's a very, you know, they call it, it's a novel virus because we don't know much about it. It's puzzling the scientific community. We're learning as we go along. It's like, you know, we've never seen this kind of stuff before. There's a whole bunch of like coronaviruses before. As, you know, if you remember back in 2003, there was SARS-1, COVID-1, okay? 2013 was the MERS, it's also coronavirus. And then 10 years later. So this might, you know, come back another 10 years. So like, it's really important to understand, okay? You know, the biology of this, this disease. So So in order to really understand this, we need to, two things we gotta really understand. It's the rate of transmission, okay? The rate of spread, okay? And the other one is the lethality, it's the case fatality rate. You know, how bad is this, all this thing kills people. So like I said, we're learning as we go along. There's different models, because by knowing these things, that it helps inform better health policies and economic policies by knowing how these things, this disease behave. And from what we know so far, we think in terms of the rate of spread, it's about, there's a number they assigned to it, maybe 2.3 or 3. What that means is one person can infect 3 other persons. Some people have put the numbers 5, 1 to 5. Compared to regular flu, it's about 1.2. So 1 to 1, that's flu. Okay, so it's very contagious, you know. So, you know, just by, you know, and there's, you know, lots of studies have shown that by just by talking can actually transmit this disease. So airdrops and aerosols, you know, it's like, it's very contagious. In terms of lethality, looking at the studies now, compared to flu again, flu is like maybe 0.1%. These things like 1%. It's like 10 times stronger than flu. Okay, so it kills people. And we know from like all the data out there, I think in the United States now there's about 76,000 deaths, 1.2 million or something like that infection. So it's a very, very lethal disease. And there are certain populations that would make it like an even lethal, okay? There are certain populations, so that's very important. It has implications on us, you know, in terms of demographics. And we're saying like, you know, for example, like in the South, in America, a lot of the Black communities are disproportionately affected. The same thing out of the Northwest, we see in the Pacific Islanders. So there's certain populations who are more prone to having disease, and when they get it, they get really bad, okay? For example, a lot of the data is coming out before over 65, then you have chronic conditions such as diabetes, hypertension, chronic heart disease, lung disease. These are the people, you know, when they catch the disease, you know, they can really have a hard time. And that's, if you look at that demographic, that's us, okay? We belong in there. So it's very important to really understand this, make sure it does not get to our people. So in terms of prevention, by really understanding the nature of this virus, we can start putting some steps. And there's the CDC recommendations, you know, but we have to make sure this also appropriate to our culture, okay? These recommendations, you know, and that's, you know, people were talking about advocacy and task force. To me, that's where the role of that task force comes in, to make sure these informations is culturally sensitive and culturally competent, you know, when we try to apply to our populations. Here in Hawaii, we do have a task force. Okay, it's headed by our Consul General, along with a few of you might know Dr. Palafox, that's been in the Marshals for a long time as part of the panel, myself, and a few other folks. And that the reason for that that task force, and the Consul General earlier talked about this, really the advocacy. I say only the best people to take care of ourselves is us. Let's face it that way, okay? We understand our people, okay? And it speaks to taking ownership. It speaks to taking initiative. It speaks to taking responsibility, okay? This is what happens, giving out the right information, so make sure that people get the right information. This is the task of the task force, okay? Make sure that the information is not wrong, it's right, and it's given in the right way, okay? And we also know that, you know, we're a culture of, you know, we are a gregarious culture. You know, we like to, like, you know, very social culture. You know, lots of congregations, churches, birthdays, weddings. We like to get along. It's like just the way we are. And so we need to, like, by having the right information, we can start making some changes. Because I can almost guarantee you this thing is not going to stop here. In the future, it's going to happen again. So it's good to have this infrastructure in place, this task force, okay? Because it doesn't have to be COVID only. In the future, it might be something else. You just change the name to like, whatever task force. And have that infrastructure in place in these different communities. Hawaii is a logistical challenge because we're different islands, okay? Unlike, let's say like Arkansas, they're in one place. So we have to make sure the Marshallese community in Kauai, Maui, the Big Island, they get the right information. So by having these small task force, mini task force, even in those places, those can be boots on grounds and have more of a bigger task force, more kind of like more a consultant role to help making sure they get the right information. So there are a lot of things we can do. This is an opportunity, this pandemic, to kind of help us kind of looking at our own, what we can do for ourselves. And let's face it, and I think other speakers spoke to this. It's part of our culture. We're a culture of shared responsibility. We take care of our own. So having a task force in place, our own task force, to really help our own people, to me, that's the right way to go. So some of the, as you know, this thing about the isolations, okay? Limiting social interactions, social isolations. It's really working in terms like preventing disease. They talk about the flattening the curve. But what that means is really to different ways to think about that. So it's given when you do these social isolations and the self-quarantine and all that, it's a way to slow these process down. By slowing it down, you're giving the healthcare system time to build capacity, as far as like PPEs, ICU rooms, mechanical ventilation. At the same time, slowing the spread of the disease. And also give time to for example, vaccinations, treatments and all that. So it's very important. And it's working. And we're seeing from places like South Korea, Singapore, where there is strict isolation, the rate of infection is very small. And I can tell in Hawaii State now, I think it's the report this came out yesterday and today, there's 0 cases, new cases. And I think because they start doing this way ahead of time, the isolations, I think in terms of all the states, they're second to the last. I think Montana is the least, and then there's Hawaii State in terms of infection rate. And their the case fatality rate in Hawaii is I think it's the least of all the states. It's because of all the distancing and social isolations. So these are things I start thinking about. So it's going to be a challenge, like I said, because of our culture, our culture, communal culture. So it's really, the information has to be very specific and culture sensitive. Yeah? And we know that some of these states, like today in Hawaii, they're trying to relax some of these lockdowns. But, we have to be careful, especially our people, because we're a different risk population. Okay, we're a different risk population. If someone else, they're infected, they have 5 bedrooms in their house. They can, go in that room. Okay, for us, we don't have the kind of luxury. So you have to really got to move very slowly, because it could be fatal. So to me, that's kind of those are the kind of information we need to make sure, our community understand moving forward. I'm going to stop here because, I give the audience a chance to chime in. Thank you.
Okay, thank you so much, Mr. Chapwer and Komotata, Dr. Will. I'm going to go ahead and move on to Andrew Polloy, our next speaker, because I think this is an important context before we go. And I know I'm aware that we are over time, so please feel free to move on to the other things. I want to honor the panelists also and sticking around for those of you who are still with us on the Zoom. So just giving you okay to leave the village if you need to move on to your other plans for the day. I think it's very important for us to talk about mental health, and because I think that's something that's not talked about when we begin to talk about healthcare. And I was very aware of Andrew's work at the University of Hawaii as a mental counselor. He's from Palau. He's a Palauan mental health counselor at the University of Hawaii at Hilo, where he seeks to create a supportive, culturally sensitive, understanding, sincere, and approachable working alliance with his clients. He is also a board member for Micronesia United Big Island, otherwise known as MUBI. And he will, Andrew will talk about mental health care and perhaps give us some tips on how we approach that. Andrew, if you would please.
Thank you, Vid. It really is truly an honor. And I'm sitting here kind of listening to everybody speak, and I am really floored on all these brilliant minds that are out there working on addressing some of the needs in our communities, in our COFA communities. And so really hats off to these brilliant minds that are working and coming together to really address some of these needs. And I'm pretty sure that it's no surprise to everybody here listening, at least I hope it's not a surprise, that when it comes to mental health and help-seeking behaviors, Pacific Islanders tend to not come to our services and utilize our services. We are probably very underutilized services in the health system amongst our Pacific Islanders. And so, you know, when Vid was here at UH Hilo, he did a study that we really tapped into, and he made some recommendations. And most of the recommendations that Vid made in his study, we've kind of touched upon, on providing, you know, right information, whether it's creating relationships with people who are in leadership roles within communities, and really creating that streamline and connecting with different communities, and being able to listen to their different needs and being able to kind of respond to those different needs. We've definitely kind of talked about some of those stuff. And so I really am happy that it has been a resounding theme throughout each speaker on this need to be advocates and this need to be able to have our own voice, find our own voice, so that we can address our health needs, and particularly our mental health needs. But going back to Vid's research, we were able to, Vid created this ideas of how we may perceive different Pacific Islander behaviors, and how it may manifest, and how we may read those behaviors, and what it means, and when we interpret those. And so he also kind of created this different suggestions and different ideas. And I'll just share one bit from his research that we kind of utilize for our mental health counseling. And kind of relating to systems and how we relate to systems, that it can present itself as a lack of trust in people associated with institutions, and that maybe institutions will not have their best interests at heart. And it can also be misinterpreted that, you know, we don't utilize those services. But some ideas that we can help to kind of close those gaps is to provide those step-by-step directions for accessing services in outreach, being very mindful of accessibility and approachability. And even something that I've done personally in the mental health counseling field is really taking away the formal way of doing counseling. That if people want to meet outside our offices, that we can be willing to kind of explore those different options to create accessibility and to create approachability. You know, whether it's just, you know, talking story, that, you know, we don't have to call it mental health counseling. We can just call it talking story. And this kind of really ties into how we can kind of take care of ourselves. Because, you know, as we go through this, even for us as providers, we have to be really mindful of taking care of ourselves. And also, you know, this is also applicable to those of us that are going through tough times, that we really are being challenged and to be creative in these moments. That we really need to kind of think outside the box, and how are we going to attend those funerals? How are we going to attend those birthday parties? You know, for the past several weeks, I've been very fortunate. We're definitely very fortunate to to be living here in the States where technology is accessible to us, that I was able to have, Zoom meetings with classmates from Palau, living in Pohnpei, living in the Marshall Islands, living in Palau, that, some of this creativity is really upon us, that we need to be able to still maintain those connections, because connections, as everybody have said, is very important to us. And that is one of the best ways that we can take care of ourselves, is to remain connected, but to be creative in ways that we stay connected. And secondly is that we really need to honor that we are in trying times, that these are very different times that we've never seen. And we first really need to honor that. Because when we honor that, we're really saying that we're not afraid of that stress is something that we should avoid. I call upon a lot of the things that I've come across through my work in the mental health field, and particularly I kind of call upon some of the wisdom that's been shared by a health psychologist, Kelly McGonigal, that we can make stress our friend, that we can find ways through our creativity, be able to honor that, yes, it is pretty different. Yes, I am worried about my future. Yes, I am feeling some uncertainty. Yes, I have no idea how to teach my high school daughter algebra. That these are all real worries and real stresses that we are experiencing. And so that we can make stress our friend, and that we can, I'm reminded of an analogy as I'm speaking about this, about the lobster. So the lobster is a soft-shelled animal living in a hard exoskeleton. And as the lobster grows, it becomes tight in its exoskeleton, becomes uncomfortable, and that the lobster needs to go underneath a rock, find a safe place, shed its exoskeleton, and grows a new shell. And it does this throughout its life. Each time that it feels pressure, it feels uncomfortable in its shell, that is the opportunity for growth. And I think as we face these type of times that we are facing right now, that we are challenged to see this as an opportunity for growth for ourselves, whether it's for ourselves, for our communities, that this uncomfortability and this pressure that we're feeling, we can utilize this as ways for us to really grow and really challenge ourselves to grow. And just lastly, I guess I'll just add on that, these times really remind me of several times in my life where things have gotten hard, whether it was in 2008 where I got laid off, and things were looking very uncertain on what we were going to be doing. And one thing that I think we share throughout the Pacific region is this history of being spiritual people, that we really truly understand that there are things beyond our control. That concept is something that we kind of share and are able to kind of lean, for me personally, is to be able to lean on my faith, to be able to lean on this prayer that, that Alcoholics Anonymous utilize a lot, and it's that, Lord, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. That prayer seems to be really applicable in these times that we are facing. And even the motto that we use for Pacific Youth Empowerment for Success, our PACIS conference that we host for our Pacific Islanders here on the Big Island, is that, we cannot control the wind, but we can definitely adjust our sails. And these ideas and these themes that we hold true in our culture, we can definitely utilize them in these trying times. And I'll just kind of end there, just being mindful of time and making sure that we leave some room for some Q&A.
Malam Sulang, Andrew Kilisotabuf. Andrew went to Xavier. He was a student of mine, so every time I see him, I feel really old. So we're going to move to the, just a quick poll again. I'm going to share it now, and this poll is basically, now that we've heard all of these, and this is not a scientific poll, of course, but what is your greatest concern for the COFA community during this COVID-19 pandemic? The options are lack of testing for COFA community, job loss for our people, lack of disaggregated data, cultural hindrances to social distancing, lack of support structures, ignorance of healthcare advice and all. So if you don't mind taking that, for those of you who are still on our call, Zoom call, just take maybe 10 more seconds. All right, I'm gonna go ahead and close it out. Again, this is not a scientific poll. So here's the result. Out of the concerns that people had to pick one, it looks like the lack of support structures is coming in at about at least 38% of the folks who took this poll. So that's interesting. So let's go ahead and move to our Q&A. Perhaps some of these questions might come up in this. We're definitely out of time, so I want to be mindful of people's time, especially the panelists, and of course, all of you who are still on the call for us. So if you have a question, raise your hand by clicking on the button at the bottom that you should see with the icon of participants. If you click on that, you should see a hand. And if you want to have a question for our panelists, click that and I will unmute you and you can state your name and the question and we'll see. Well, it looks like there's no questions, or maybe I'm not reading this. I'm not seeing any hands raised. I had said some. If I'm not recognizing you, go ahead and unmute yourself if you have a question and go for it because it's not popping up. Okay, looks like there's no, there are no questions.
I have one question. Can you hear me now?
Yes, I can, please.
Hi, my name is Q. I'm from Costa Mesa. I want to applaud this conference. Very, very nice and very important. I was thinking about the people from the Marshall Islands who are stranded in Honolulu. Has any of the panel members given a thought as to their ultimate answer to the questions as to their being stranded? I know that not as a very uneducated guess or thought, perhaps testing could be a major deciding factor as to whether or not they can return to their families back in the islands.
I'll leave it open to any of the panelists, perhaps Will or Shelton, if you know anything. And go ahead and unmute yourself and speak, please.
Hey, that's a really good question. Can you hear me? Oh, sorry. Can you hear me?
Yes, we can hear you.
Yeah. So, yeah, that's a very important question. There's actually a handful of people like stranded here. In fact, there's one staying in my place now. I'm supposed to go home, but can't. Yeah. So, and we get a call with our task force, and the Secretary of Health is actually in the call 2 weeks ago, and they're pretty strict about their ban, the travel ban now, because they really feel that that's how the COVID is not there. by really shutting out the border. So, but I think on June 5th, they're opening it up again. I'm not sure if they're going to move it again, but that's kind of the plan right now. Well, I know there's ongoing discussion in there, DJLA, about the stranded people here. I know there's like some kind of monetary assistance for them to help them while they're here, but it's a big. I think it's becoming big political pressure. I think the best people to speak to this would be the consul generals because they know more about this kind of policies than me.
Again, just gonna piggyback real quickly on what Dr. Alec mentioned. I can say that at least from yesterday, I had a chance to talk with a few folks, including our consul general and the ambassador out of DC. So it sounds like at least for the folks in from the Marshall Islands who are stranded in Honolulu, I think they've come up with some kind of fund that the government is going to be providing to those folks, but they will need to meet certain requirements as far as their travel dates, as far as when they left the islands and went to Honolulu. But I know that at least I saw Consul General Eldon and Tamara Aine was on the call earlier, so I don't know if she's still around, but they probably can speak more to that. But that's my understanding, that they were going to receive some financial support in the time being.
Okay, thank you so much. Thank you, Q, for that question. Just a reminder to mute yourselves if you're not speaking. Any other question? We'll take one more question.
I have a question.
Go ahead.
I'm from Washington State. I'm Gigi Jolly. Anyways, I have a question for this, and I first want to acknowledge and respect and thank you very much for getting this COFA panel up. I'm just wondering, what can we do? We're a bunch of COFA people that, for real, some of us really don't understand each other's culture, and some of us sometimes have a hard time. Like, let's say me, I'm a Marshallese. If a Chuukese or somebody else, they're not really open. People are not really, we have our own thing, Not in a negative way. I'm just saying that how can the COFA come together so we can try to educate our communities. I think it starts from the leaders and to let our people know, individual COFA, that, hey, we need to get together and trying to figure something out, because I've seen a lot of, let's say, separation. This is not a time for separation. As part of, as a Marshallese, you're trying to get what your Marshallese people need, or anybody that needs anything in their own culture. So I want to know, what is the next step for this COFA to get together and trying to let our people know that it is okay to help each other, that we should help each other, not separate us. We almost have the same culture-wise, but then again, we're different. We're all different. So if I'm to talk to somebody else, they may not like that. That's the reality of things. They may not agree with me because I am a Marshallese. So I just want to know what's the next step with this COFA, because we're all over the place. Separate states have done the COFA work and trying to get the medical law and everything. But it's for the whole United States, it's federal of COFA. But then again, we're separated in states of what is, the Medicaid, everything, the unemployment, but it's all COFA problems. So I just want to ask, and what is the next steps of how we can do this?
Yep, that's a good question. Thank you so much for that great question. This was, and it was especially because we're running out of time, I wanna be mindful, and maybe I'll put it out there to everybody that, this was never intended to be to kind of solve it all, but maybe the first step of many, hopefully many interactions and coming together to do this. This is not, I want to be mindful that this is not in competition with all of the organizations are. In fact, this is not an organization. Pacific Leadership Assistance Network is not an organization. It's just just a network of folks. And so I'm hopeful that we'll continue to work together with the sponsors of this organization, this event, to really answer that question that you've posed. What's the next step, right? As Dr. Joachim Peter would say, how do we move from discussion to action, right? Because that's what matters. So I'm going to open up just the question to the panelists, and we'll take maybe a few minutes, and then I would just say that really maybe this question deserves a lot more, and so maybe if people are open to it, we'll organize another discussion on that, just a follow-up discussion on the next step. What can we do collectively as groups of people that are labeled COFA, but also how do we help each other in our smaller communities? And I want to honor, maybe I'll put Joe on the spot because he's president of CAN, which seems to have done a successful job of organizing the different language communities, the COFA communities. Maybe he can shed some light on it for us. What might be the next step for us now, Joe?
Well, thank you for sending the $1 million question to me to answer. But I think that it really, you bring up a really good point, Gigi, and I want to honor the work that you're doing. Thank you so much for talking about unity and the need for us to connect and coordinate better. I think, if I'm not mistaken, that's kind of where you're wanting us to maybe provide some tips. And I think, again, it doesn't have to necessarily be us. It could be you, Gigi, could maybe tell us how our other folks from the other communities can connect. But I think really it's the connections like these. If we do them more, I think naturally other people who are watching it and sharing this could, like I said, like catalyze a movement where we can all come together. Now we are, in the chat box talking with people who we haven't met before, but this is the first time that we're meeting, and now we're like, oh, we're aware that these are people who are concerned about it. So my own personal take is that, Dr. Vid, this platform, because there really is no platform. I think we need to recognize that we don't have like a really robust, well-funded infrastructure that will hold this reality of coming together as COFA. We don't have that. We lack the resources, but we do have this amazing leadership that each one of us can bring. And what I think is, an opportunity for us, what's right for us to be able to continue is this platform that we have and continuing to share information. I think a lot of the what's going on nationwide, worldwide, is that people are coming together for the first time. So I think the answer would be us here today. What do we think? Should we continue this? Should it be a different format? We can all, share. Maybe I would suggest maybe reaching out to everybody else, everybody here, and then others after this to maybe say, hey, do you guys want to meet together? Is this a good use of your time for us? And then I think we can go on from there. I think that would be my suggestion, my humble suggestion to that question. But definitely open to everybody's comments and suggestions.
Thank you so much, Joe. One other comment, and then I think we're going to go ahead and close it down. But I want to, before give it to somebody else to maybe share a thought. I just want to give at least to all of you the assurance that at least from my work at San Jose State University, that they're very much in support of this. So in terms of the technology and working, with our leaders to utilize whatever resource we have at our disposal, so that we can all count on that. Of course, on the personal level, you always will have that. But any other thoughts on that from any of the panels?
Again, give a short thought.
Thank you.
I agree with, everything that Joe had mentioned, and, I agree with Gigi's question, because, what is the next step? And, really, and you're correct, we're all working in separate states, and we think that we're all working in silos, but, we have great leadership, and, we have the Micronesian way, we have the Micronesian heart, and we're trying to find ways to treat or find ways to make sure that our families and our communities are well taken care of. So, maybe this virtual village meeting is the first step for us to connect all these silos. I think this is the time that we need to connect all these different lakes into big oceans so we can start talking. Because, each individual state is different with the challenges, but we're the same, we're same, but we're different. So you got those challenges, but I think as we're learning from each other, what works in one place and that doesn't work in another place. But, if we can, great that Vid and, San Jose State is definitely willing to put up the technology for us to reconnect. I think, we should reconnect, we should, think of reconnected at a different date for us to kind of talk a little bit more and, leave it open like a discussion, an actual village meeting. So we kind of come up with ideas and share. So we go forward from this. But, that's my opinion on that.
I think that's a good closing for this event. Thank you so much, Shelton. Thank you to our panelists. Very humbled by the great job that you've all done. I know that I had asked all of you for 5 to 8 minutes so we could keep on track, but I knew that was just lying to myself because y'all come with so much wealth of information, so much passion for your work that I knew that you were going to be speaking out of the great depth of your hearts and great knowledge base. So let's go ahead and close this. I want to thank all of the folks who've stayed with us. There's still 62 people, down from 92, I think, that started with us on this village discussion. I will assure you that I will work with at least the panelists to figure out another time, if we can, just to have a discussion rather than presentations, have a what's next and how do we do this, particularly through this. And we'll do another invitation out on the pacificleaders.com website for others to join us and have that discussion. But I think we all deserve, and the people deserve, for action-oriented discussion following this, because I understand this is more information, kind of awareness, and discussion did not happen correctly, but that's what we have today. So on that note, I want to say thank you. Malmasulang, mahalo, sijuus mase, komotada, kalangan kulo, kamagar, kiliso jabur, away generik mayon. Thank you all very much, and God bless you, and stay safe, please. Take care.
Thank you.
Thank you.
Thank you. Thank you.
So, thank you all.
So,
Moldada.
Kumol.